Doc Steve. It's a Saturday already, and fireworks we're going to talk about. We're going to talk about how hot it's for Steve out on that side, but we were just talking seconds ago. Pickleball was something that Jody and I did last weekend, Steve. There was a charity pickleball tournament. Somebody put my name in there, and I frantically had to find a partner. Who do I call?
Isabella, my daughter.
His daughter.
It was fun to watch, I tell you, Steve, because they had to play 5 matches. And, Isabella hasn't played a whole lot of pickleball, but she's a tennis player. She's a very, very good tennis player. So anyway, I watched them the whole time, 5 matches. One of them was outdoors, Brett. Remember that?
Oh,
hot, really hot. But you guys did a phenomenal job, and you won the tournament.
Well, it was the rookie category, Steve. It was the rookie category. I've played a little bit, but Isabella's got that tennis forehand that every Galichia seems to have. Okay, so she carried the team, and it was really fun. It was really a fun sport. So many people are playing this sport these days. Isn't it neat?
My gosh. There is an epidemic of pickleball, and pickleball has a lot of goodness to it, Steve. Now, I don't know if you're seeing it down in a smaller town. Do you see pickleball being played in Parsons?
Yes, one of my friends, my radiologist's wife, Vicky, he has a KU basketball court in his backyard, and she changed it to a pickleball court.
Yeah, a lot of people are doing that. There's a gentleman who's supposed to work on my tennis court, and he says, well, I'm traveling around the country putting in pickleball courts everywhere, and I don't have time to get to your tennis court. I'm like, tennis court? I mean, tennis is falling down a bit in comparison. And I think that there are some good things, Brett, about pickleball. And one is that you don't have to have a lot of training to play it.
You don't.
People just go out and play. And the second thing I like about it, Steve, is it's kind of a casual sport. People will go, if you play tennis, you call ahead, you get a partner, you get court time reserved, and that's your time. And when that's over, it's over. You can sit back and have a drink or a cup of coffee or something. But with pickleball, people just go, they show up. There are a bunch of people I know who go about every day at 11 o'clock, and they hang out, and then somebody will play with them. And they don't care who. It's like, okay, I was able to play today. I got somebody to hit with me. And that makes it more of a social sport as well, and a little bit less intense of a sport. Now, nobody wants to lose in pickleball. I can tell you, just a little bit that we've played, that's something that you just don't want to do. But I think that the skill level isn't as high as it is for tennis. The complexity isn't as high. And I think that people get a lot of exercise. So good sport, Steve.
And I'm looking at the picture here, and I see a variety of clothes. They don't have the special little white uniforms that you wear when the girls are playing tennis.
Yes.
Well, there are a couple things that you need to know about pickleball, and everybody needs to pay attention to this, really. And one of them is one of my pet peeves, and that is that there are people now being injured in pickleball in the eye. And the reason is the ball's hard. It gets hit back at you very, very rapidly. The velocity of a pickleball that's coming towards you can be very high, and it fits right in the socket of your eye. So now there are about 40 people worldwide who've lost their eye playing pickleball. And there's a simple solution here. They're making now a little cover for your eyes. It's transparent, and it would protect your eye against that. But I noticed that very few pro pickleball players are doing that. And the average person just plays pickleball and doesn't even think about it because, it's not so often that you do get hit in the face. And one of the rules of pickleball is to try to hit the ball low back at your opponent because it's harder to return down by your feet than it is higher up. But some of these balls will come very high, and they'll come at you very, very quickly. So now what we're seeing is more pickleball injuries than we've ever seen before. And part of the reason is that more people are playing pickleball. So the more people that are out there, the more injuries. But there are leg injuries that we're seeing, and different kinds of leg injuries. A lot of times people will be heading in one direction and then the ball goes the other way, so they make a quick turn, fall, and get hurt.
An Achilles heel.
Achilles heels, hurting your upper extremities when you fall. And look at that increase in fractures from pickleball. But part of that is not so much the increased danger of pickleball, but just the increased numbers playing it. It is the most rapidly growing sport in America today. And Europeans are starting to play it too, but not quite at the same level that we are. They still like tennis a little bit more. So, Steve, you've never seen a pickleball injury in your career. We didn't even have pickleball then.
No, we didn't. When I was, 40 years ago, I did go with Dr. Pye, and we went to this concrete room with a little blue ball and a racket that's much smaller than a tennis racket.
Yeah.
Hit that little ball around in that room. And before I did that, my ophthalmologist got me some eye protection glasses, some safety glasses to play racquetball with.
Yeah, same thing. The trouble is nobody is really promoting that. And so the average pickleball player walks in and starts playing and, got hit in the face. And I've had one good friend get hit in the eye, but didn't lose his eye, but really got hit badly. Okay, so fractures can occur, sprained ankles can occur, rotator cuff injuries because you're turning your racket, you're trying to make it find a ball, which is how you can get that kind of an injury. And then Achilles tendon injuries and tears are on the rise. And that's one thing that, you can get an Achilles tendon injury from almost anything. But Steve, if you hurt your Achilles tendon, if you tear it, if you have an injury to it, that is a very hard thing to get over. And some of those need surgery. So, I'm a little surprised at that because you don't see a big rise in Achilles tendon injuries in tennis. And there's a lot of similarities here, but it's a small court. You have to move quickly. And then a lot of people will reach way out to get a ball, and that's what causes it.
And what you're saying is, hey, this is fun. Let's go do it. They have not had physical conditioning. They do not do the stretching that when I'm at Allen Fieldhouse, the players are spending a half an hour before game time doing special exercises that the physical therapists are having them do to prevent these sorts of injuries.
Yeah. What I see in pickleball is hardly anybody doing any exercises prior to.
Yeah, Isabel and I did not stretch out. As to Steve's point, it's the same thing. And what happens is that we all love to get on there, play doubles. Doubles, you really don't move around. It's so fun. But I think I've seen at least 3 of our guys push off with that foot, and the Achilles goes back to their calf, and it snaps. That's happened to Eric Fisher and a couple of our friends with just the lightest of movement.
Yeah. That's a crazy thing.
It is.
We rarely see that injury in tennis, although there is a lot of similarity. You got a racket, you got to get to a ball, you have to hit it with a certain, usually, with a certain spin to it. And, don't see that many of those kinds of injuries. In tennis, you do see leg injuries, you see shoulder injuries. A lot of people, serving a tennis ball will find that they've strained their shoulder and then wind up sometimes have to get a different kind of procedure done, actually.
Yeah.
Hey, let's talk about something else, Steve. Of the moment, pickleball reigns, but right now, I'm concerned about fireworks. And, fireworks is really a highly touted thing. You know, kids love fireworks. Families love to take their kids and show them everything, you know, whether it's Roman candles or, you know, any kind of thing, a firecracker, something that makes noise and makes a lot of light. But the injuries from fireworks are really, really significant. Now, Steve, there's one story that I guess maybe I've told in the past sometime, but it's a terrible thing. One of my friends lost his brother from a fireworks injury. And here's how it happened. They were driving along, they were throwing firecrackers out the window. Brother was sitting in the back seat, and all of a sudden the wind blew and a big sack of fireworks flew into the back seat, ignited, exploded, and killed him. You know, you can't get anything worse than that. And of course, the family, I mean, forever and ever, they've lamented that, you know, they did that, you know, they allowed it. It was just a horrible, horrible thing for everybody, including the other members of the family who were in the car. But aside from that, Steve, you've worked in ERs and you've worked in the operating room, and you've seen all kinds of injuries from fireworks. What do you think is the worst thing you've seen, aside from my friend who lost his brother?
Well, the one that jumps to my mind first, I don't know that it was the worst, but that jumped to my mind first is some of my, just like you described, some of my son's friends had fireworks, and just because it went bang, it wasn't going bang big enough. And they wanted to make a small bomb, and they made a small bomb, but it went off when they didn't want it to, and it was very close to them. And so I actually had to take several of those friends of my children to the operating room to remove a lot of shrapnel. And then over the years, had to take them back because more shrapnel came out, just like a war wound. My son wasn't with him because he had a job and he was at work that day. Otherwise, he'd probably been with him, he said. The other thing is, I'm stealing this phrase from one of my other emergency room surgeons. He said, when the patient comes in and you see that they've got this injury from fireworks, you ask them the question, well, how'd this happen? And they will say, well, doc, it seemed like a good idea at the time.
Yeah. Yeah. Well, I mean, the better idea, honestly, is just don't let your kids have fireworks. You know, you can go to a fireworks show anywhere in any town almost, and some incredible show will occur. You know, they'll have a fireworks display. You can see everything that you could imagine there. Lots of colors, lots of things in the air, lots of sound, and that's it. But it's the home fireworks use that really creates a lot of risk. And that's where people get hurt. I've never heard of anybody going to a fireworks show and getting hurt. It's possible, you know, and there have been injuries like that too, where something just backfired and hurt other people watching. But generally speaking, these are things like, you know, you see little kids with sparklers. I'm like, oh, why would you give your 5-year-old a sparkler?
Sparklers have the highest temperature at the spark than hardly anything.
Yeah, it is absolutely on fire. So that's one thing. And then firecrackers, numerous ways can hurt people. There are people who've lost their fingers, who've lost a hand due to fireworks. So just look at this injury chart here. Well, 2022, 11 deaths, 10,200 injuries.
Nationwide.
You can see that these injuries were higher in 2020. And I wondered about that, Steve, because that was a pandemic year, and more people stayed home with their kids and their families, shooting off fireworks, doing anything, you know, having a picnic at home or something. You just weren't going anywhere. So there were a lot of injuries that year. I think people are wising up a little bit, wising up. I think that families are, they're saying maybe this is not a good idea, turn our kids loose with a sack full of firecrackers. What about Roman candles? Do we still have those?
Yes, they do. And the tendency is that it's not a paint gun. You're not supposed to shoot it at somebody else, and
Ah,
and those things can go off in your hand. Anything that you have in your hand that's going to explode, I think, is bad. Uh,
yeah.
because I'm really old, I think that my Lone Ranger pearl handled cap gun probably wasn't too bad, but
Yeah. Yeah.
but all the other fireworks, if you have them in your hand, is really bad. And one of the things here in rural southeast Kansas is things like bottle rockets or other fireworks of any kind. If you've got a hay field or a wheat field, you get a spark near any of those, and it can cause a tremendous amount of damage and that you can't control. And that's all. Really big fires is always a problem.
Yeah. Yeah. I think the main thing here is be careful. I have friends who own fireworks displays, fireworks stands and things, and they sell this stuff, to people. I think there's some limitations on who can actually buy fireworks. It can't be just a little bitty kid walking up with a $5 bill and ordering some fireworks. But, I think everybody in the world has tried to control the risk of fireworks. And when you get right down to it, there's some risks here that you can't control. Let's look at that screen here where it shows the different kinds of injuries. Brett, that one, yeah, I can't see that so well, but yeah, there we go. Safety tips. Basically, don't get fireworks and definitely don't just turn your kids loose with them. That's one very important thing. And it looks like many of the fireworks occurred sort of away from the family. They were just like walking around outside doing things. And kids on their own can get in some big trouble with fireworks. So here are some of the safety tips. Never allow children to play with or ignite fireworks, including sparklers. And sparklers, for some reason, that's one thing that families will often give their little bitty kids as a sparkler. And like you said, the heat of a sparkler is astronomical. It can hurt badly. It can put your eye out. It can cause a severe injury. Make sure fireworks are legal in your area before buying or using them, because fireworks are not legal just everywhere. Keep a bucket of water or a garden hose handy in case of fire or other mishap. I mean, that's one that I don't think anybody does. Okay, here's a bucket of water. Take your Roman candles out there and fire them off. But what a good idea, because if there is a fire, you can put it out immediately. Light fireworks one at a time and then move away quickly. Yep, that makes good sense. Never try to relight or pick up fireworks that have not ignited fully, because it may be just a late, tardy ignition. Never use fireworks while impaired by alcohol or drugs. Whoa, I'm not sure about that one either, because a lot of people will start their 4th of July pretty early. And then when it gets dark and it's time to use the fireworks, they're kind of 4 sheets to the wind. So no drugs and no alcohol when using fireworks. And for gosh sakes, don't get drunk or semi-drunk and then pass this stuff out to your kids.
Right.
So anyway, those are just some very, very simple things, but they're always on my mind during this holiday, Steve, because not only the death of my friend's brother long time ago, but many injuries that I've seen through the years. and most of them were totally avoidable. It's like if you just didn't have this in your hand, nothing like that would have happened. So my recommendation is to enjoy fireworks somewhere, not home, not in your backyard, not in your children's hands, not you showing them how you fire off a firecracker or a Roman candle or something else. So
Yes, like you said, even here in Parsons, we have a annual city fireworks display on the 4th of July, and the local radio station will put on a synchronized music show that goes with the fireworks, and so that's always kind of fun.
Yeah. The other thing I will say this too, after you blow off your fireworks in the middle of your cul-de-sac, clean it up. I've been in a couple of cul-de-sacs. You get up in the next morning and guess what? The teenagers were out there at 10 o'clock and all of their debris is still in the middle of my cul-de-sac. So this is sort of etiquette for anybody blowing it off. Clean up your mess, right?
Yeah.
Right?
Yeah. And then I think one thing to just remember is if something doesn't ignite right away, don't go and pick it up, because sometimes fireworks just don't explode immediately. And that's how you can get hurt as well. Picking up a live piece of fireworks, whatever it is, and have it go off in your hand is a common injury, and it's just terrible. Hate to see that. Well, despite all that, there are great things to do on this holiday. I mean, great things. We're going to do something that we always do as a family. We're going to go to Colorado, and we have a place that we go there, and it's a great place for hiking. So, I looked up a little bit of information, Steve, about hiking and the goodness of it, because it's got its own little problems. You go up a mountain, you have to do some pretty serious climbing sometimes. And then one other thing, on one occasion on this mountain, there was a mountain lion who came up from behind and then finally just left. But that will scare the heck out of you. And there's no way to control that. You're out in the woods. So anyway, some people have analyzed this and said, hiking is one of the very best things you can do, whether you do it at home, in your backyard, or wherever you go. And, it brings you to nature. It exercises your heart and your legs. It's a fun thing, and it's a great thing as a family. You may do some talking along the way, and I like to go hiking with my family. I think it's a great thing to do. But there are some little things you got to be careful about. One is overdoing it, especially if you're at altitude, because oxygen levels are lower there. And if there's anything like if you have an illness, heart disease, lung disease, you can get very short of breath the farther you get up that mountain, if that's what you're doing. I think that the beauty of hiking is being out there. You're with nature, you're kind of away from all the things that happen in your life just for a little while. And that's a wonderful thing to do. But if you have heart disease, high blood pressure, diabetes, or if you're really overweight, hiking can be a dangerous sport. I love it. I think it's a fun thing to do. We will go on a hike every day on this trip to Beaver Creek. But you got to be careful. And the other thing I always tell people is don't go hiking alone, because if an animal should come along, and you're alone, the risk is greater. And secondly, if you just happen to have one of these unusual episodes where you couldn't breathe or the altitude level got to you, if you're in the mountains, then for goodness sakes, you need somebody with you. But most hiking doesn't occur in the mountains. It occurs in neighborhoods and in parks and various places. Going for a walk is going for a hike. But I think we associate hiking with some climbing, with a little bit of nature thrown in. What about it, Steve? You still go, you swim, but do you go for walks and hikes?
Not very far, because I'm my PTSD with my defibrillator go off. I get afraid that I'm going to trigger it if I get my heart rate up.
Right.
My
Yeah.
son John is a Boy Scout leader, and he and his scouts do a lot of hiking. My son Joe, he lives in Denver, but he does a lot of bicycling.
Yeah.
He's one of the mainstays of our Sheila Miller multiple sclerosis bike team, but that's his main entertainment throughout the whole year is bicycling. So he's out there, but with a piece of metal and rubber helping him.
Well, bicycling is another great form of exercise. It carries a little more risk, falling injuries, car injuries, car accidents, running into other bikers. That happened to a friend of mine recently. Uh, they were biking coming down a hill, and somebody else was coming down the hill, got out of control, and ran into them, caused a back injury, and it was a terrible thing. So you got to be careful on a bike. And what I see in our neighborhood is a lot of little bitty kids, 5-year-olds, riding around on bikes way out in front of their parents. And I think, this neighborhood, maybe you can pull that off because there's nobody driving really fast around here. But sometimes they do. And, I've not seen an injury from it here, but certainly working in the ERs, Steve, there were bicycle injuries pretty commonly that we would see.
Yes, there are. But in these recent times, I have seen more children with helmets on than when I was a child and when my children were young. Nobody had a helmet on,
Yeah.
and so I'm very happy to see that. Wearing the helmet is really important because I've had several people in their 70s who have a bike crash without even with their helmet on and sustain a traumatic brain injury, and
Yeah.
so that is a concern.
Well, that is the biggest risk, I suppose, of all. But wearing a helmet obviates that risk tremendously. Got to wear a helmet. And I see all kinds of people still riding motorcycles and bicycles with no helmet. And to me, that's just irresponsible. And don't let your kids ride without a helmet, for goodness sakes. Most of the little kids riding through our neighborhood here are wearing a helmet, but not all the parents are wearing a helmet. And I just think it's the only smart thing to do. Again, I go back to a personal story. One time I had bought a brand new bicycle and I was going out my driveway and it was a little bit wet. And I fell so quickly, I couldn't do anything to brace myself. And I did hit my head on the side, but I had my helmet on. And I remember getting up thinking, wow, that was a blow to my head, but I don't have a headache. I don't have anything wrong. I'm okay. Thank goodness for that helmet. So the helmet is extremely important, and I think helmets for some of these sports that we're seeing, like pickleball, either helmets or, something that covers the eyes, are going to become more and more common. I mean, a helmet is an easy thing to wear. It doesn't impair your athletic ability, really. Football players, they wear helmets all the time, and look what they do. So I don't know why the resistance to helmets is there, and it shouldn't ever be there for your children. I tell you, it's just so important.
Sometimes I try and make a comment that's funny. Rarely does it come off. This one, I'm not trying to be funny. Is if you're going to ride a motorcycle without a helmet, make sure that you have made pre-arrangements to be an organ donor.
Yes.
Yeah.
Yes. Yes.
Well, I think you're absolutely right there. The chances of getting hurt badly are just tremendous. And motorcycle riding has there's a fun component to it. You're outside, you're moving fast, but you see people weaving in and out of cars on motorcycles, going really fast. I'm like, gosh, what if somebody just opened their door? It's just an insane thing to do. But I'm not a motorcycle rider, so I guess I wouldn't know. I mean, I've never done that very much at all. A little bit in Europe, and a lot of people ride motorcycles and scooters there. A lot of people use scooters, and the scooters are cheap to operate, and they will get you downtown to pick up the groceries and back home, and that's how people use them. Either way, if you're out there exposed on a bike, a motorbike, a motorcycle, a scooter, you got to wear a helmet. There's just no question about it. Boy, we talked a lot about getting older and what it means. And Steve, you and I've, we're on this trail. We are getting up there. But they were talking about things that you do to preserve your being as you get older. And I think that exercise is important. Being engaged with your friends and relatives and family, extremely important. But Steve, what are some of the things that you think? Don't smoke, don't drink too much. That's basic.
Yeah, I think that for Steve Miller, the ability to go to the swimming pool and do my laps is wonderful. I also take aquasize classes with some old ladies, but I found out that I'm older than the old ladies anymore. And
That's ladies, right?
and being active and being around people, that's extremely important. Not being alone.
Yeah. Well, there's some data that's come out recently about loneliness and what it means to people. And as people get older, loneliness and seclusion become more of a problem. Can't get out as easily, don't have as many friends. A lot of friends have passed away. The number of people that you are close to tends to diminish somewhat. So loneliness has been related to an increased stroke risk. It's related to depression. It's related to vices like alcoholism. People say, I'm home alone. What am I going to do? Well, break out the wine, break out the bourbon, have a couple drinks before I go to bed and it'll all be good. But in reality, aging is something that hopefully we all experience. The longer you live, the more you have to cope with all these things, your health, loneliness factor. Like you said, Steve, having things to do and having things to do with other people are very, very important. The right diet is very important. Eating a high level of fruit and vegetables, not overeating, keeping your weight down, not smoking, not drinking. I mean, we could go on and on.
And not playing with fireworks probably is another good thing too. Probably, I would guess that too to be right.
One of the things, everything that Jody said is absolutely wonderful for the prevention of loneliness. The patient in the doctor's office who is complaining of depression, it is so the physician will order an antidepressant, and you have an antidepressant on board, and then you decide, here I'm home alone and I can drink. Those are bad combinations.
Yeah.
I think that ignoring vices, but not doing it, just put that bottle down, maybe one glass of wine is fine, but when you start drinking a lot, and people tend to do that every night when they're alone.
They do.
And having activities, be involved in volunteerism, help other people, help your neighbors if you can, do little things for people. I think is extremely important. It makes you feel better about yourself. So those are things that we recommend to people. And one other thing, as you age, be sure and see your doctor often, at least every 3 months or so. When there are vaccines that come along, get them, respiratory syncytial virus, flu shots, herpes shots, Those are things, shingle shots, they're all of those things when they're available, make sure that you take advantage of them. It's very, very important in your aging. And also it's important for the people around you. When you get sick, your friends sometimes get sick with the same thing.
And don't play with fireworks.
Yeah.
That's
Stay back from the fireworks.
Stay back from the fireworks.
Don't give your grandkids fireworks in your backyard.
Thanks, Steve.
Thanks,
All
Steve.
right.
You guys.
Great topics, everyone, and thanks for your comments.